I'm Dr. Rick Green, Senior Medical Editor of General Surgery News, and we're coming to you from the annual meeting of the Southeastern Surgical Congress in New Orleans. And it's my pleasure to meet this morning with Dr. Melissa Red, as she's known, Hoffman, from Asheville, North Carolina. Red, thank you very much for being with us.
Oh, thank you. I'm so excited to chat with you.
Well, one of the things I really wanted to talk with you about, and I'm very excited, is your interest in palliative medicine as a surgeon. Mm-hmm. So I have to ask you, as a surgeon who was formerly trained in surgery, how did you get involved in palliative medicine and hospice and the kinds of things that you do?
Sure. So I actually got to write about this a little bit last year in JAMA on A Piece of My Mind. But when I was 19 years old, my dad was actually killed by a terrorist in Cairo, Egypt. And of course, it was a very tragic, sudden death. And it really shaped everything about me, how I think about life and death and how I think about grieving. And I kind of took all of that experience and eventually ended up, one, getting very interested in trauma because of the way my father died, but also getting interested in what happens after a trauma. And so I was very lucky. I went to medical school at OHSU in Portland, Oregon. And Oregon is an amazing state. One, it was the birthplace of death with dignity, or physician-assisted suicide. And two, it was also, OHSU is the birthplace of the POST form, or in North Carolina it's called the MOST form. And so palliative care was integrated in everything in my medical education. And as a fourth-year medical student, I already knew I was very interested in trauma. I had a great trauma mentor and was applying for general surgery residency. But I also did a month-long elective with the palliative care team, and it really just blew my mind. The way that they would enter a room full of grieving, suffering people and just sit down and engage with them and hold space. And I said, oh, I want to learn how to do more of this. In residency, I went to a program, Maricopa Medical Center in Phoenix, Arizona, and we did not have any palliative care program at all. So I did what I could. I had learned a lot from this palliative care team in medical school, but definitely wanted to learn more. I did an elective as a general surgery resident, but knew that in order to really do it well, and also to kind of, I think, gain the legitimacy of my colleagues, I knew that I wanted to pursue a fellowship as well. And so I did a fellowship in trauma and critical care, and then went and did another fellowship in hospice and palliative medicine, and have really been able to combine the two in a way that I think serves my patients well, but also makes me as a person very happy.
So is this career path something that you should do only if you're interested in academics, or if you want to go into practice in a community? That's
a great question. I'm actually not. I'm in a community, more like a hybrid program right now. So in a community hospital, we do have residents, and I think it lends itself to both. I think there are some people who are drawn to this field, the surgical palliative care field, because they want to do research. So I think of someone like Dr. Zara Cooper, who is an incredible leader in our field, and Dr. Ann Mosenthal, both who are prolific researchers. And then I think of myself, who I'm an acute care surgeon, so a lot of my patients are either older emergency general surgery patients or sometimes tragically injured young trauma patients. And palliative care just lends itself to my daily practice. I mean, there are often times when we'll either operate and the end result is not what we or the family would have hoped for, or sometimes people are just not, I think an operation's just not appropriate at all. And instead of saying, there's nothing else I can do for you, the idea is, let's just shift focus and let me walk with you through this next stage of life. So I think it actually works well for either more of a community practice or an academic practice, depending on what makes you happy. For me, I wanted to focus on social media and podcasts, and I feel like that's my contribution to the field. And for someone else, they really might want to look at outcomes and how we can justify including palliative care within the surgical world more from a financial perspective. And I think both are really important.
It's obvious to me that you have found a career path that really makes you happy, and it makes me happy. We've been talking today to Dr. Melissa Red Hoffman from Asheville, North Carolina. Melissa Red, it's so wonderful to have you here.